back, many people and organizations are going pink this month to raise awareness about breast cancer. Dr. Jennifer Almonte Gonzalez joins us now with more on the symptoms to look out for and what people can do to prevent falling victim to this disease. And thank you so much for joining us.
Thank you for having me.
Great to have you. And you've been practicing medicine for quite some time now. And just from what you've seen, how prevalent is breast cancer here in the Valley?
Well, about 1 in 8 women, as you mentioned earlier, will develop breast cancer over their lifetime, and the Valley certainly does follow that same pattern and those same statistics. I have seen and diagnosed breast cancers in my practice.
And have you noticed that more people are coming earlier now?
I feel like people do come in earlier for detection. I feel like especially during October, a lot of women are more aware, and so a lot of women are coming in either with breast symptoms or just to schedule their routine screening because there's so much public awareness now about breast cancer. So I feel like October is a really busy month for us.
Definitely. And are there people who are more susceptible to developing breast cancer?
Yes, there are. There are certain risk factors. Family history is one thing to consider, although most breast cancers that are diagnosed in women, those women actually have no family history of breast cancer. There are certain genes that make us more susceptible to breast and ovarian cancer, and those mutations are known as the BRCA1 and BRCA2 genes. Women who have a family history of early onset breast cancers, meaning before the age of 45, those are candidates who may want to consider talking to their doctors about testing for those specific genes, because women who are positive for those genes actually have a 70% chance of developing breast cancer over their lifetime versus a 12% in the general population.
And when it comes to getting those screenings, is there a particular age or a time when women should get these breast screenings?
Breast screening should begin, annual mammogram should still begin at age 40 and be done every year thereafter. If a woman has symptoms or any concerns prior to that, she should see her doctor right away and get screened sooner. Annual breast exam by a doctor should begin around age 20 and should be done actually every 1 to 3 years. Self-breast exam is also important as well, so women should begin doing that around the age of 20.
And is there anything that women can do to help prevent this? And we were talking earlier about, some people think just because they're young, maybe they won't get breast cancer, but really there's no age to this. Women and even men need to be aware that they can get breast cancer, and it's almost like we forget that men are susceptible to this disease as well.
Yes, males are susceptible to breast cancer, especially those who might carry that genetic mutation I was speaking of earlier. So in fact, if you have a family member, a male who happens to have breast cancer, that person should definitely be tested for the gene. Women can also just follow a healthy lifestyle, avoid smoking, exercise, follow a good diet, take your vitamins. Those are all things that have been shown to help prevent breast cancer.
All right. Well, thank you so much for joining us.
Thank you for having me.